Hello friends, Dr. Lipinski with Strive Physical Therapy and Pain Management. And in this video, we'll be talking about regenerative medicine, and in particular, regenerative injection that is targeting the meniscal tear in a professional dancer. As many of you know, there's a lot of ways to stimulate regeneration in the body. In our practice, we use a variety of methods, including ozone therapy, PRP injections, PRF injections, whole blood, as well as the combination of ozone with all three, whether it's PRP, a PRF, or whole blood injection, as well as injections of exosomes, stem cells that we can extract from fat tissue, as well as the stem cells that we can extract from the bone marrow. In this particular video, Dr. Alhov, our specialist in regenerative medicine, will be using slightly diluted version of PRP, platelets-enriched plasma, with some of the blood of the patient, and will enrich it with ozone. For those of you who don't know, ozone is a gas, is a highly oxygenated oxygen, if you will. And it goes into the cell and it stimulates the regeneration of the cell. In a very lame terms, it literally rebuilds the cell from inside. Now we use it to turbo boost the action of the PRP, which is your own platelets, to stimulate the regrowth of the tissue. This particular patient, who is a professional ballroom dancer, will have a meniscal tear. And her meniscal tear is quite a difficult type that is an oblique tear. Now often those oblique tears goes under the operation and have to be cleaned up and sewed together. Now unfortunately she cannot have operation at this point. She needs to finish her career. She has few competitions ahead of her. We chose to perform a regenerative treatment since she cannot take time off right now for surgery. In most of the cases, people actually can heal really well and not undergo surgery. Now meniscus are cushions that are separating two bones in the knee, and when the cushion tears, usually especially the medial cushion, it tears in 4 different ways, but in this particular patient it torn obliquely, so it tears in this direction. And often when people are walking or dancing or squatting, that part of torn meniscus gets entrapped onto the condyle, under the bone, and creating a lot of pain and inflammation. So the goal of the treatment is to stimulate the regenerative process within the meniscus and let it heal from within, instead of trying to cut it or sew it together as an operation. It's going to consist of a series of few different injections. And to start, we always starting with the ligaments. Now part of the injection will go inside the knee, but a lot of what you're going to see right now will be a ligamental injection. When the knee tears, part of the reason behind the tear is the instability of the medial knee or medial collateral ligament and some of the musculature and tendons that creates a support on this side of the knee. And an instability creates an extra movement in that portion of the knee, creating more gliding and sliding and friction that creates a tear of the meniscus. So first, we're going to create a stabilization of that ligament. Now there's also prolotherapy that we often use, and we're going to demonstrate how it's done in a different video, but it's a dextrose, it's like a sugar water that creates a microinflammation within the ligament, causing the ligament to contract together and create more stability. But in this particular case, we want to create regeneration of the ligament as well. So we're going to be using a slightly different substance to cause that healing and regeneration. Now please keep in mind, all of these injections are natural and none of them have corticosteroids or any other substances that create destruction of the tissue. They all create healing and rebuilding, regeneration of the tissue. So right now you're going to see how this procedure is performed. Alright, Dr. Alhov, we are doing today what? Regenerative treatment for meniscal tear, right?
Yeah. We're doing a meniscal tear, regenerative treatment for meniscal tear, and I'm mixing right now blood with ozone. So it's gonna be help me to activate.
Okay, so blood is being mixed with ozone, so PRP is being mixed with ozone. We're still keeping some of the erythrocytes in so the ozone can latch to them. And
Okay, just a little bit.
as you can see, the substance is being injected first around the knee into the ligaments. The ligaments are responsible for stability, and usually that's the instability that causes the hypermobility.
Ruin our video.
And the meniscal tear eventually.
Okay.
You're doing interarticular too? Just
everything outside the knee joint.